I'm Dr. Sheri Slezak. I'm a professor of plastic surgery at the University of Maryland. If you're thinking about cosmetic breast augmentation, there are 6 decisions which you have to make. First, there are 2 types of implant, silicone and saline. Each have advantages and disadvantages. Silicone is soft and feels more like a normal breast. Saline is a bag of salt water. It's firmer and more rubbery than a silicone implant, but if it ruptures, you know it immediately. You're flat within 24 hours. Silicone feels more natural than a saline implant, but it's harder to know when it's ruptured, so it requires MRI surveillance. All silicone is now made out of cohesive gel, and so if it's ruptured, the gel stays within the confines of the implant and it doesn't leak throughout your body. The second decision you need to make is whether to have a round implant like this or a contour profiled implant like this. Although this looks more natural, most augmentation patients want to have some upper pole fullness. A profiled implant can also shift, and that may not be desirable. The third decision is whether to put the implant above or below the pectoralis or chest muscle. Below the muscle is better on mammograms. It rises a little higher, and it has a less incidence of capsular contracture, which is scar tissue forming around the implant and making it firmer than we would like. Above the muscle is less painful, and it ages more naturally, and it rotates the nipple up a little bit. Another decision is whether to have a smooth implant or a textured implant with this fuzzy surface on the implant. Texturing was designed to have less capsular contracture, but it sometimes will show wrinkles or shift. The fifth decision is what incision to have the implant placed through. Most people have a 4-centimeter incision in the inframammary fold. Other alternatives are around the edge of the areola or in the armpit. The last and most important decision is what size to have. People have different objectives in having breast augmentation, so people make different choices. Most people choose somewhere between a 200 and a 450 cc implant. A 200 cc implant will make you just 1 cup size bigger, more back to what you were before you had children, and a 450 will make you a full C and is about as much as we can get in at once. You can generally try on breast implants in your doctor's office, and that will help you choose a size. If you're considering breast augmentation, you have to know that there is generally future operations. Implants last about 15 years and will have to be replaced sometime in your lifetime. You should also talk with your doctor about the complications associated with breast implants. The FDA website about breast implants is very good reading. So although you have several choices to make when you have augmentation, be reassured that most augmentation patients are very happy with their choices. So I hope this information has been helpful to you.